Eli Capouya. My specialty is adult cardiothoracic surgery. My father practiced dentistry in Montgomery, Alabama, and I guess initially maybe I thought I would become a dentist and just take over his practice, but then I had a good friend that his father was a general and vascular surgeon, so I had the opportunity to go watch him do surgery. And then when I was in college, I had the opportunity to actually work for him in surgery. And I went to medical school at the University of Alabama in Birmingham, was exposed to cardiac surgery and the heart-lung bypass machine, and for me that was kind of the epitome of practicing medicine. And once I finished my general surgery training, I went and did a cardiothoracic fellowship at UCLA for 3 years. And subsequently things have evolved to the point that now I'm currently working with PIH Health. I do a variety of heart and lung operations, a lot of coronary artery bypass grafting surgery, a lot of valve surgery. There's sometimes infections with the lung, sometimes cancers with the lung, and we predominantly do those kind of operations for the lung. Understand that sometimes you might be in an operating room for 5, 6, 7, 8 or more hours, depending on the complexity of a procedure. I mean, when a patient is willing to have me literally take their lives into my hand, it's a major commitment. So, but it just doesn't stop with doing the surgery. So I make myself available, whenever, at all hours of the day to my patients. And all along the way, you're just telling yourself that the one thing that you want to see is for that patient to come back to your office and have a complete recovery and back to an excellent quality of life. I think you do have to get away from the hospital and the practice of medicine and the daily grind on occasion. So I have an amazing wife and 2 wonderful children. And again, they're all very supportive of me, and none of them ended up going into medicine. Maybe they saw, the difficulty of day-to-day life for a cardiac surgeon and the hours you have to keep sometimes. But I think most of all, at the end of the day, I'm appreciative for my wife and my family for allowing me to do this. I think the strength of PIH Health and the reason that I joined PIH Health is we have cardiologists, cardiac surgeons, and a number of other physician specialties all working together on the same team to achieve the best outcomes for patients.